Welcome back to Super Doc Stories. I'm your host today, Dr. Mona Sodhi. And today I am so excited to bring to you Dr. Ashanthi. She is a board certified neurologist, a Menopause Society Certified Practitioner, and the founder of Healthspan Neurology. She is one of the only neurologist-led practices in the country dedicated to cognitive longevity and dementia prevention. She has over 25 years of clinical experience and a rare dual expertise in preventative neurology and menopause care. I'm so excited to talk to you about that. She really helps patients take action on their brain health during the most critical window of their lives. I love that. Welcome, Dr. Ashanthi, to the podcast.
Thank you so much, Dr. Mona. I am so excited to be a super doc.
And we are too. So you have a wealth of knowledge, and I want to dive right in. But I would like to say first, you're the only doctor I know of that is combining neurology and menopause care. I mean, talk about being at the bleeding edge of medicine and entrepreneurship as well. What inspired you to kind of combine those two really interesting areas of medicine?
Well, just very practically speaking, my interest in dementia prevention has been brewing for several years. And when I realized that two-thirds of dementia cases are amongst women, and that's not explained just by the fact that we live longer, we're also two-thirds of caregivers. And being a woman who's now postmenopausal, but seeing my own brain changes and my own experiencing my own menopause related symptoms, I thought, how can I not, if I want to do dementia prevention, if I really want that to be my understanding and my focus and call myself an expert, then I need to understand two-thirds of patients, what they're experiencing, and see it through a more scientific lens versus just my experiential lens. And so that, as many OBs say that they get like, a few hours of menopause uh, training. I can tell you that as a neurologist training in the 90s and the early 2000s, there was zero time spent on menopause. So I just felt like if I'm going to serve two-thirds of my patients, then I need to really have a better understanding of menopause. So that's where that intersection was born.
Yeah, that's so fascinating. Um, I love that you're combining these two, and I think it is so needed. That brain fog is often spoken about, but not properly delved into by any physician. So
Yeah.
that's an excellent service that you're providing. So I want to take it back a little bit. You mentioned that you trained in the 90s and the early 2000s, did your residency in neurology. And tell me about, kind of what life was like back then. Did you go into neurology knowing you would be an entrepreneur, or were you sold the life of being in employed medicine?
Yeah. So, yeah, it's funny because when you said back then, I do feel really old and in a good way, though. But what I mean by that is, so I actually, I became a neurologist because honestly, there was no better way to engage with the human condition. That is, to me, and I think everybody feels this about their field, but you go into medicine because there's something about the human condition, human suffering that reaches out to you.
Hmm.
And to me, that is neurology has served that well.
Yeah.
And I always wanted to be a community doctor. I actually
Okay.
really wanted to be, I mean, if you think of like the old town family medicine
Mhm.
doctor who knows um,
Everybody.
everybody, that's what I
Yeah.
wanted to be. I just didn't want to be an internist. I wanted to be the neurologist who did that. So out of training, I went fellowship and then went straight into private practice. And
Okay.
this was 2003 that I joined a practice. And I honestly, for 10 years, I had the storybook career in that I had wonderful partners. I saw
Hmm.
patients for an hour each
Wow.
because it was a private practice. So what
Yeah.
I made, I took home, right?
Hmm.
Minus overhead. And if we had a lean overhead, I was comfortable with my modest income because I was really happy. And I
Yeah.
saw 8 patients a day.
Hmm.
And, it's not for everybody, but it was really what I wanted. I loved my partners. I loved neurology. I loved the community medicine field
Yep.
that I was working in. But then it started to change, and medicine became an industry,
Yep.
and we were checking off boxes. We had guidelines that we had to meet. We insurance reimbursements
Yeah.
for neurology in some went down about 40% in the course of a year.
Wow.
So it was not sustainable to do the practice I was doing, and I did that for a while. My 8 patients turned into 12,
Right.
make the same
Right.
amount of money. But then it became more like 12 to 15 to make the same amount of money. And
Hmm.
I was just not happy in what I was doing. And
Hmm.
this all happened in my mid to late 40s.
Yeah.
And my father passed away when he was 44. And he
Wow.
passed away of a cardiac arrest. So when I was 44, I started to reflect more existentially on my own life
Hmm.
and my own health. And it became apparent to me that all of my father's siblings developed dementia.
Mm.
He died of a cardiac arrest at 44, and three of the four developed dementia. So this is
Wow.
my future, is what I saw. And so I started exploring dementia prevention and applying some of that understanding to myself. um, and then that just sort of started brewing in my head in terms of, how can I make this like not, I don't think I ever thought about making it a business. I actually made it, how can I incorporate this into my clinical practice with my patients?
Okay.
And it really wasn't possible within an insurance-based industry. So by 2023, I was kind of at a crossroads of, do I leave medicine altogether and just call it a day? Um, I was lucky, it's not that my husband's a math teacher, and I always tell people, the beauty of marrying a math teacher is you live by a spreadsheet and you
Yeah.
live like a math teacher. And if you live like a math teacher with a spreadsheet long enough, you're going to
You're
be
fine.
you understand compound interest really
Yeah.
early.
Yeah.
So that's what we've done. And we had, my kids were starting college, or, and so it was a crossroads. Do I follow my passion and my heart
Hmm.
and stay in medicine, or do I just quit? Staying where I was not an option for me. My soul was crushed. My love for medicine was, I was becoming resentful of patients instead of sharing in their
Yeah.
that human connection was not a good one. So I took a little time to sort of process for myself what my next steps would be. And then I decided to take a leap.
That's amazing. Wow. And thank you for being so vulnerable. Not everyone is able to really say like that connection was not what it was before with my
Yeah,
patients.
yeah,
It takes someone who's really done that reflection to be able to say that out loud. But good for you for recognizing it and making a decision to opt out of that system. I talk to a lot of doctors in person on this podcast in our business, and it is about that 2015, 2016 timeline that people really noticed medicine
yeah,
took a nosedive.
yeah,
And there are doctors that were able to pull themselves out of it, but it created a lot of frustration and recipe for burnout in the whole medical system. So this was about, so you were in that practice about 20 years, if I'm right,
23.
23
Yeah.
years,
Uh,
and then you made the decision to open your current practice. Is that, do I have my
mhm.
timeline right?
Actually,
And
I was there 22 years. I'm sorry. Yes. And then I left. I took about 6 months off just to
okay. Yeah.
clear my head.
Hmm.
And I'm going to say clear my head and recover from what felt like abuse. So it really felt like coming out of an abusive relationship
Sure.
and just needing to find my own footing.
Yeah.
Yeah, and then I opened the doors of my new practice, and
Yeah.
I've been seeing patients now for about 13 months.
13 months.
Yeah,
Congratulations. That's phenomenal. And I'd also want to pause for a moment and say that your partner is a big deal in this equation. The fact that you had someone who sounds like they supported you, not just with math, but in your,
yeah. No, I
transition. to entrepreneurship, and we don't always talk about the support person that allows us
Absolutely.
to spread our wings and fly and continue to thrive. So it really matters a lot. And I'm sure there were a lot of long, hard discussions about how is this going to work? What is it going to
Mhm.
look like? What is at risk? That kind of
Yeah,
thing.
absolutely.
But I have my partner, my husband is a physician himself and has allowed me to fly.
Hmm.
And I can't imagine not having that. I don't know
Hmm.
how it would be possible to
Yeah,
do it, to do
absolutely.
everything.
I
So
know
thank you
that
for bringing that up.
for myself, you said, how it takes an insightful person to be able to reflect and put a name to that. And I'm going to be honest, I didn't put a name to that. He put a name to that. And at one point, this was in early 2023, he said something has to change because we'd been together since I was in med school, and so he'd seen, and he's not in medicine, but so he sees it from the external lens of,
Hmm.
the sacrifice that you've made, the number of times you've gone in overnight, or been nursing your baby and left in the middle of that to go and see a
Right.
patient, etc. Right? We've all done those things, and when you're not in medicine, you see how bizarre it is.
Yeah.
Right. And I
Yeah.
think because he's not in medicine, he was able to say, you've gone, as a physician, you go above and beyond,
Yes.
and you've given so much. And he didn't take it for granted as just normal. He just saw it as bizarre.
Crazy, right?
Right. And then when he saw that my joy and my engagement with my patients, which is 100% why I do this. I mean, as I've told people a lot of times, most doctors are really smart. If we were in it for the money, trust me, there'd be other ways to make money. This is not the smart way to be making
Yeah.
money.
Right.
Uh, so we do it for that human engagement, that human connection, and when that was lost, he was the first to see it. And he said, you need to get help. You need to figure this out. You need a coach, you need a therapist. You need
Hmm.
some
Hmm.
way to really work through what you're experiencing because this is not sustainable. And even though, I mean, I was the primary earner in our family for over 2 decades.
Hmm.
And he said, he was able to say, and again, he's thinking in terms of numbers, he was able to say the opportunity cost of your health, of
Hmm.
your mental well-being, of your staying in medicine, and what that might earn for us in the future, even needs to be addressed.
Yeah.
Because just staying in this pit of
Yeah.
despair
Yeah.
is not a place to be.
Yeah.
Yeah. So
No,
I'm so grateful for him, truly, every
mhm.
day. Yeah.
Yeah, to be able to tell you that. And
Mm.
health is wealth, right? It's everything. So
Yeah.
if
Yeah.
you're practicing at the cost of your mental health, if your physical health, you really do need to pause and consider what your options are at that point. It is that critical.
Mhm.
Um, I think when we're on our deathbeds, we're not going to be thinking about the amount of money we made.
Yeah.
It's the
Yeah.
relationships we had,
Yeah.
right? It's the
Yeah.
connections. So
Yeah.
it's great to talk about those things. They're not easy conversations by any stretch, but
Mhm.
necessary, and
Mhm.
that's wonderful. So you
Vulnerable.
very vulnerable.
Mhm.
So you've been open for over a year now,
Yeah.
and tell me kind of what it's looked like stepping into this version of entrepreneurship, being in solo practice.
Yeah.
How has it been? Tell me a little bit about your journey into opening the practice.
Yeah. So I think it's been terrifying. That's that's probably the best way to describe it. It's been
Mhm.
terrifying. And I don't mean that in a negative way. I do it all over again, and I
Mhm.
encourage anybody to do it because, if I had stayed, I think the decision point, I'm going to just go back to that, the decision point of do I stay where I am or do I keep moving or do I do something different? And it was really this thought, this understanding. This is the least I'm going to be. And is this where I want to stay forever?
Hmm.
Or, if not you, who is going to do this?
Right.
And I really have developed a passion for dementia prevention. And I saw,
Hmm.
I can make this a clinical model.
Yeah.
And I don't have anybody telling me how to do it, but I'm smart. I've
Yeah.
seen thousands, if not 10,000 patients with dementia. I can figure this out. So,
Right.
if I'm not going to figure it out to make it accessible to people, then how is this going to happen? So that's really what motivated me to move through that terror. That
Yeah.
still is what motivates me to move through the terror.
Hmm.
Um, some of the hardest parts was what would my peers say? I mean, that's,
Hmm.
we go through medicine looking for affirmation, right? Like who's more affirmation greedy than a med student? And, and so we
True.
go through true, right? Like, yeah, we're just
Very
like
true.
greedy for praise. And
Yes.
so like the thought of people saying, which they did, oh, look how much she charges, or dementia prevention, is that even a thing? Or you know, she doesn't know what she's doing. Who's going to go see her? Or um, I can't believe she doesn't take insurance. What about all those patients she's letting down? So all of those thoughts, as well as when did she become a dementia specialist? All of
Yeah.
that
Yeah.
really is what you're thinking. And um, I think at the end of it, you have to sort of say, well, why are you doing it? And
Hmm.
for me, the motivator was I figured out something really cool,
Yeah.
and I did it for myself.
Yep.
And I developed a systems-based clinical model on how to do this.
Right.
If I don't share it, who else is going to share it?
Yep.
And what do I have to lose? So my reputation, but you know what? The people who really matter to me, they think what I'm doing is really cool,
Hmm.
So, and the patients that I can't tell you how much like each Google review means so much to me, right?
Yeah.
Like in the past, it really didn't matter as much, but now, just the Google reviews, the letters that patients send me, I just, those are kind of in my mental
That's what
vision
keeps
board
you.
because
Yeah.
they're really what keeps me going. Yeah.
Yeah. And Super Doc, part of what I do is coaching, and we talk a lot about how your offer or the package that you sell is not about you. It's about
Yeah.
the transformation you provide for the patient. And the
Hmm.
more you remember that, the easier it becomes to talk about what you do, to be open
Yeah.
about it, and to
Yeah.
ignore the naysayers, most of which are in your head,
Yeah.
right?
Yes.
Most of them are
Yes.
in your head
Yes.
of, oh, they must be thinking this. I'm sure they think that. But the reality is, most people are thinking about themselves most of the time.
Yeah.
And if someone does have the desire to speak up against what you're doing,
Yeah.
chances are they didn't pursue something. There's something
Yeah.
they're
Yeah.
fighting in themselves, and you just let it be.
Yeah.
And that's
Very
okay
true.
because you know why you're doing what you're doing. So it's great that you realize that, and that the people that matter most to you are supportive of what you do. And that's what
Hmm.
matters, and that you've created transformation by
Hmm.
your
Hmm.
patients. And
Hmm.
that's really what matters at the end of the
For
day.
sure. Yeah, absolutely.
Many of our doctors are also cash pay, myself included, and there is judgment, there is resentment from others about that, but it's just a different model. And I think everyone can agree that the insurance-based system is quite broken. And for those of us that were able to figure out a path to leave it, that, shouldn't be judged so much. I think it should be more, well, how did you do it and what
Hmm.
worked? So
Hmm.
that's why we love having these conversations with trailblazers like yourself in these industries.
Hmm.
So so that it sounds like it was really scary to open this practice, and you accept the fear, but you still push through based on the positive feedback from your
Yeah.
patients, which is amazing. Tell me kind of, what does the typical week look like nowadays? Are you in the clinic every day?
So a typical week is clinically divided into is really just seeing patients. So I still see
Mhm.
neurologic consults,
Okay.
but the bulk of what I I really want to focus on is the cognitive longevity evaluation.
Mhm.
So I see right now anywhere between 3 to 6 patients per week. So, I'm not busy as I want to be, but it's slowly picking up.
Mhm.
And the other time is spent really a lot on building systems and marketing and
Mhm.
sales and
Mhm.
introductory calls with
Sure.
patients and going out to referring docs and
Okay.
letting them see my face. And so it's a
Yeah,
lot of these,
absolutely.
and it's a lot of the things that I think, 5 years ago, if somebody told me I'd be doing my own speaker events or on a
Mhm.
podcast
Yeah.
or,
Mhm.
writing newsletters or doing YouTube videos, I would never have believed it. But I actually, that I'm pretty introverted, quiet, shy person. I would never think of myself as a trailblazer, except I think what I'm doing is trailblazing
Mhm.
now.
Absolutely.
And the thing about trailblazing, when you really believe in something, it's not that hard because it's like you said, when I think and reflect on the difference I have made, then market what I do because without me, that person's life would be so different. So I think
Absolutely.
it's affirming. There's the med
Yes.
student again needing that affirmation, but it
Yeah.
is it is very affirming. Yeah.
Yeah, I love that. So for any of the listeners who feel like they identify with you as an introvert, you can do it too. And it becomes
Yeah.
easier when you believe in the mission that you're on and the people that you
Yeah.
help. And like I said, make it not about you, make it about the person, the patient that you're serving.
Mhm.
And really for you, it sounds like the families of those individuals, everyone involved benefits. It's not just one to one, it's actually one to many. The ripple effect is real of the lives
Yeah.
that you're
Yeah.
touching.
Hmm.
The other important thing I want to highlight that you said is that even though you're beyond the 1 year mark, we're still marketing. We're still putting ourselves out
Oh, for
there.
sure.
It's required at this,
It's required. Yeah.
it's not a hospital system that will feed you patients. You've created a service that is cash based, so you don't have you're not on a panel of insurance companies to tell their patients to come to you. So you do have to do that legwork, and it is doable. Um, you just need to remember that it's not a one and done situation.
Yeah. And
It's
it's
not.
probably the hardest part of it, right? Because I remember leaving and I met some docs that I know at the gym or the grocery store, and
Yeah.
many would use these words. They would say, "What are we going to do? You're our rock star neurologist." And I was like, "Oh, that's great," because they're all going to send me their patients. And they don't, and they
Yeah.
see me again and they'll say, "Well, we wish we could." But because of the cash pay aspect of it, I think they feel like there's a
Yeah.
barrier for them to even
Yep.
broach
Yep.
that
Yep.
conversation with patients. So I get it. It's just that because of that, you have to
Yeah.
not selling is not a is now what I realize is absolutely non-negotiable. But
Yep.
if you believe in what you're selling, it's not a sell. It's an offer.
It's
It's a
an offer.
gift.
And
Yeah.
and being okay with no or not right now is
Yes.
completely
Yeah.
okay.
Yeah. Yeah.
Yeah, I think that you brought up another really good point that not all insurance-based doctors will understand or feel comfortable promoting your services as cash pay.
Mhm,
And
mhm,
that's why you have to open up to other types of, practitioners. And
mhm.
maybe not even practitioners. Maybe it could be a local business bureau. It could be
Yeah.
something non-traditional like that, a group of people that really care about their health, like maybe moms like yourself with kids in college that now
Mhm,
they finally have the time to think about their own
mhm,
health.
mhm,
Speaking to where did they go? Do they go to
mhm.
their local health club? Do they go to Mahjong? Like what are they
Right.
doing?
Right.
And
Right.
speaking there. So that's a really good point that it doesn't have to be the traditional, I call it like the farm rep talk. You don't have to show
Yeah.
up,
No.
with
Right.
candy or pamphlets all the time, door to door. There's
Mhm,
really creative ways of doing it. We had one of our clients and she would set up a booth at a farmer's market to get patients and really have
mhm.
these organic conversations with them about, direct
Yeah.
primary care, and it was very effective.
Yeah.
You just have to learn about, the culture of the people that you serve and meet them where they're at. So it is very doable, and having a plan really helps kind of make it bite-sized pieces so that you can tackle it and
Yeah.
weave it into your week rather than have it be all consuming.
Yeah.
Great. So, as we wrap things up, I wanted to ask you, Dr. Ashanti, with your experience in opening up this practice, if someone on here is listening, and they had one piece of advice to take away from our conversation today, or something maybe we haven't even touched on yet, what advice would you give the person who's ready? They've got an idea, they want to open up their direct specialty care practice, or maybe even insurance-based practice. Is there anything that you would tell them now, knowing, what you've learned through your experience?
So many things. I think this is the least you'll be. And you're
Yeah.
a physician. You have such capacity to
Hmm.
grow. Why stop now? I'm
Right.
55. Why stop now? Right? Like I could have just said that I'm done. But
Yeah.
there's so much potential for us. So your brain, it's really good for your brain. Keep growing.
Yeah.
And then the other is also really good for your brain and your cognitive development is community, right?
Hmm.
Finding a community that supports you.
Hmm.
I mean, I'm so glad my husband was there, but
Hmm.
beyond him, what I lacked for a while, and I've like in with engagements like this, I've grown is a community that to support me and
Hmm.
to be my vision board,
Hmm.
to sound off ideas. It's incredibly important to surround yourself with other like-minded physicians. It really is
It
because
is.
I love the word super docs because it just means that it's that community of those that are doing something a little extraordinary
Yeah.
is possible, and to have that community is incredible.
Yeah, I love that because we talk a lot about how there's the valley of despair that we go through. And
Hmm.
we often have this uninformed optimism when we start a practice, and quickly we
Yes,
realize
yes,
the realities of it and
yeah,
become a little bit pessimistic and despair. But that community is what gets you out. So
exactly. And the
that's
sooner
huge.
you find it, the better.
Yes.
Yeah.
All right. Well, we love creating part of that community here on Super Doc Stories. Dr. Shandi, if we have a listener here that would like to get in touch with you, whether it's to refer a patient or to just connect with you on a professional level, what's the best way for them to get in touch with you?
Yeah, so I'd love anyone to reach out to me. You can find my website at www.healthspanneurology.com. You can email me at Dr. G, so DRG at healthspanneurology.com. And you can find me on social media at Dr. Ashanthi, so
Okay.
dr.ashanthi, Ashanthi. And I would love to hear from you
Yeah.
guys. And whether it's professional, a lot of people, if you're a woman in menopause, or if you're a man in midlife, if you have questions, I'm happy to at least guide you and nudge you in the right direction.
Oh, that's very generous. And we will include all of the links in the show notes page so that you don't have to write it down, listeners. You can just grab it from there and get in touch. Thank you so much for being on our show. This has been really, really valuable. Thank you, Dr. Ashanti.
Oh, thank you, Dr. Mona. I loved being here. Thank you.
Thank you.